Wait. So we are beginning. So I just sent you. I've already loaded up the rest. The other two items that are on our exam, I have to get through two more bits of anatomy before we do the rest. Be plenty of time. So I just put these up. This is lymphatic, and the other one is going to be respiratory. We'll surely get through the lymphatic today. I don't know. Maybe the respiratory will have to be Friday. They are pretty much one-day units. Lymphatic certainly is. Respiratory, maybe some overlap. So by the time I have to get the respiratory in for a lab, because we're going to do the lab with respiration. Hello.
Hi.
Hello. I was blaming Dr. Dress, not you.
Oh, thanks.
You already get me in trouble
Okay.
because I forgot to post the grades the right way, and you're already complaining.
Plus they were out.
I know. I didn't. It's ultra. Blackboard Ultra. They have everything you post potentially says hidden from students. And yeah, they never had this. We're using the same Blackboard for 25 years. It's okay. You're forgiven. It was my fault, my error. I'm never mad at somebody because I was dumb.
No, you weren't.
I was dumb. I could. No. Trust me. My wife will tell you I'm not brilliant. Yes, sir.
The next test, cardiovascular, including heart, obviously, respiratory.
I will look. It's heart, blood vessels, a little bit on lymph, which I'm doing today, and respiratory anatomy. Done. That's it. We end with digestive, urinary, and repro. And this is very straightforward stuff. I mean, I've been comparatively. This might surprise you, taking my time with this. You're all looking at me like lymph. So lymph is really the circulatory system associated with and by we have to cover the anatomy, not just of the lymphatic vessels, but also the thymus and the spleen and lymph nodes, which are lymphatic organs. Basically, they are the circulatory system that's associated with the immune system. So they're very, very specific in what they are. So there are vessels that typically accompany veins, and the distinction is it's not a closed system. Their open end is deep inside the tissues where the capillary beds are, and they're picking up waste products and fluids that are either too heavy, too fatty, or other irregular substances that are not compatible with traveling in those very, very tiny, very, very narrow capillaries. It's just they would clog them up. You just want to think mechanically. That's what lymph vessels are. Because of what they pick up, they are typically the passageway for infections, bacteria, viruses, parasites. Typically travel by the lymph because the lymph eventually will make its way to the general circulation, typically dumping in the lymphatics as they're collected up into the superior vena cava. So I mean, it's an oddball system. When you hear about you ever seen somebody who had blood poisoning? Okay, when you see in the old days they would have a line like going from their, let's say they had an infected finger going up to their elbow, be deep red. Your elbow would be all swollen. We call that blood poisoning. Effectively, it was called lymphangitis, inflammation of a lymphatic vessel, because it's carrying it to way stations where it would join lymph nodes, which are basically little sentinels that warn you. When your mom said you had swollen glands, those were swollen lymph nodes. Your mom would do this. You feel around here and here. Oh, you have a sore throat. They feel up here, the preauricular nodes and things like that. Oh, that could be a problem. Now maybe you have a strep throat or a bad infection. Maybe you better go see the doc. So we have the fluid is lymph. The lymphatics are the vessels. I do have somewhere I have a handout about this. I will look for it. Okay. You notice I found that, yeah, I found some other ones. That's true. So and basically the lymph nodes process it. Basically they filter it and get rid of a lot of the problems that are associated with it. So the structural bases are the lymph nodes, okay? And they're basically white blood cells that do their job, including the spleen, thymus. And the ones you've heard about are very, very specific name lymph nodes, for instance, are tonsils, and the other are adenoids. So tonsils and adenoids they're basically lymph nodes that are open to the outer environment. And rather than having to go through the lymphatic circulation, they pick up stuff from what you eat or what you breathe. That type of stuff. And typically when they're swollen or enlarged and chronically infected is the criteria for removal, which you typically don't want to do at your age. I have a student in the class just before you, they were so bad she eventually had to have them removed within the last week or so. So that's maybe 2 weeks ago. That's not easy when you're an adult. Little kids recover from it more rapidly than that. So the lymphatic system returns interstitial fluid, leaked plasma proteins, heavy fatty laden substances, sometimes bacteria, virus, or other microorganisms, okay, via these lymphatic vessels. 3 liters is a lot. It's nearly a gallon. That's 3/4 of a gallon, more or less, of lymph. Okay, and then once it enters those, now it has become lymph that is there. One-way system, open at the tissue level, all the way back, flowing only toward the heart. It's because it really doesn't have any pressure associated with it. The pulsations of your vessels, mechanical movements, so whatever's helping the veins to move is basically helping the lymph to move, because really they're associated with all the veins more than anything else. Wherever you see a vein, there's a tiny lymph vessel making its way along with it. Where we don't have them, bones, teeth, bone marrow. Okay. So we know in the CNS, but now they're found in certain locations, and maybe they play a role with fluids and cerebrospinal fluid. That's not a big deal. For our purposes, everywhere there's a blood vessel, with the exception of bones, teeth, and bone marrow, is fine. What you gotta know. So, and their structure is similar to capillaries. They just are more permeable. That's why bigger stuff, heavier stuff, unusual stuff can get in there. Larger molecules, again, protein, cell debris, pathogens, cancer cells. The cells are, comparatively speaking, quite large. I mean, bacteria are smaller than our cells, certainly. Viruses are very, very small. You all had micro. Do you know how tiny they are? Always happy to offer a refresher on micro. And again, this is one of the problems that are there. I mean, it's good and bad. So here you can see them intertwined with that typical capillary bed that's there. This is the open-ended nature. And again, it's sort of like a valve. When there's movement or pressure, it opens, and then effectively when the pressure is released, it's sort of like a mini kind of like suction that helps to pull those materials in. If you want to think of the mechanics of it. Even though, and to me, this is more of a physiological, but I do have some basic anatomy I have to go over with it. And basically this sums it up. As the vessels go along their travels, the lymph filters through. And this is, I mean, really, it's a microcosm looking at that particular illustration. And you'll see it a little bit better. Typical lymph node usually has maybe 2 vessels of egress, outgoing, and multiple vessels of ingress. Big small opening. So you put a bunch of stuff in there, it takes a while to get through. Effectively, what it's doing, and the term I always like to use is sort of percolates through. In the old days, we made coffee with a percolator. So basically, you had water was in it. There was a hollow metal thing, a little basket, and effectively with its own filter. You put the grounds in there, and through the hollow metal tube, so where oil would come up, drip down, come up and drip down through the cranium. And over time, you have an electrical like this. You don't give a big event like a wedding or a bar mitzvah, new one, huh? We've been to a bar mitzvah. You don't know what you're missing. You from Fox Chapel?
I never got invited.
Oh, they didn't know what they were missing. I've got the formula. How many gila have two, have three gilas? Socioethnicity is showing. But it has multiple areas, and then all the lymphatic structures are in here, all the lymph node structures are in there to basically filter the lymph. It filters its way through. That's really how it works, and a lot of the structures work that way. Multiple points of ingress, limited points of egress per force. It's forced to go through there. See, that's, you can look fancy if you say per force. Okay. I was like, you can say it's a fait accompli. Well, after all this stuff happened, this is what's going on. We can say that's a fait accompli. So increased permeability due to two specialized structures, mini valves. And so increase in extracellular, the volume of fluid creates its own pressure and opens them up, and it kind of gets sucked in. And when we get to digestive, we will see the lacteal. The lacteal in your digestive tract, we really cover this more in digestive. They're tiny little finger-like projections called villi. Each one of them has this lymphatic vessel surrounded by a mini capillary bed. And the stuff that comes in, depending on what is being absorbed, will either go into the capillary bed, or if it's the heavier, different stuff, goes into this. The name of that fatty lymph that comes from there is called chyle, C-H-Y-L-E. So in the old days, we talked about chyme and chyle. Chyme is the food that you're digesting. It becomes a paste called chyme, C-H-Y-M-E. And then the lymphatics brought back chyle. So you heard old time they talk about chyme and chyle. There's a lot of, and here are these so-called mini valves. We got to know about them. So, and they are just collected by series, as they will with any vessel system, gradually increasing in diameter. So they start with lymphatic capillaries and get lymph vessels and larger vessels, and etc. And then they have different trunks, and eventually there's a couple of major ways, and there's a very unique way that they're arranged anatomically for your studying pleasure. So again, similar to veins, thinner walls, there's a whole lot more communication in the sense that these vessels are constantly sort of intertwined together. That anastomosing means there's a lot of combinations. The trouble is when stuff goes bad, when somebody has, have you ever seen somebody with deep phlebitis, where they've had a major blood clot and their leg is giant, they get to the point where the lymphatic vessels are compromised. And I mean, do you have any idea what elephantiasis is? Elephantiasis is a parasitic infection, for those who aren't familiar with it, that affects lymph, and it blocks those lymphatic vessels, and all that stuff can't get up, so their leg gets swollen. We only see it with a particular fly or carrier in Africa, and it gets larger and larger and larger, so it looks like an elephant's leg, because that stuff is so thick and heavy, it almost congeals and solidifies. So you always see illustrations of that. So that's a disease that happens to affect it. And it travels with, as you can see, deep vessels a little closer to the artery, skin with the superficial veins that are there. And there's all these different trunks which you don't have to know. Don't care. Okay? The way we want to be able to see the two major collecting stations and what they service. These are the two stations anatomically. You have the trunks going to one of two things, the right lymphatic duct, and whenever we talk about veins or we talk about lymph, collecting means draining. So all the time, it drains the upper right arm, the right side of the head, and the right side. The right lymphatic duct, right arm, right side of the neck, right side of the head, thorax. The thoracic duct, everything else. In the thoracic duct, effectively, in a certain percentage, this is again, it's an older term, that we saw sort of in the diaphragmatic area, there was a cistern or a well. That's where the term cistern comes from. You know, biblical terms, I'll say, oh, they were at a cistern. If you look at older documents and stuff. Cisterna chyli for Kyle. Each empties into the venous circulation at the junction of the jugular vein, the internal jugular, and the subclavian veins on its own side. So, and they're going to come together and form the superior vena cava. So the right one is on the right, the thoracic duct is on the left. And you should have a really good illustration. It just shows it to you. So here you can see the dump points. So if you're coming in, and it really isn't a distinctive, for instance, the cisterna chyli, when it's present, you can see it just here, really just above the diaphragmatic area. And then if you look at where they put thoracic duct, again, they draw a faint line in and around this area, not a distinctive structure. Where the right lymphatic duct, again, not a significant structure that's there. So they're just significantly bigger than the typical lymphatic vessel. But really, this is more pertinent to know what they affect. So again, if you just remember what the right side of head, right side of thorax, right upper extremity, everything else, that's all right thoracic, that's all the right lymphatic duct, everything else is thoracic duct. Definite question's going to be there. Very anatomical. Notice where they are mostly concentrated. You have any place where you have communication with the outside, you always have large amounts. So think of areas where you have opening, the head, neck, mouth, nose area, tons and tons of lymph nodes there. The anogenital rectal area, tons of lymph nodes there in the groin. Other areas that collect, axillary, those natural pitted areas, indentations, popliteal fossa, cubital fossa here in the elbow, axilla. That's where you find concentration. So if you're a physician, like I said, if you see somebody you look at their hands and you see something, it's an infection like that, and it's red, even if you don't see a line, where are you palpating to see if there's an enlarged node? Here or here. You see they have a sore throat, you're palpating here. Moms do that. When we had infections on the foot and ankle, I mean, you go up and you end up right into the groin area, palpating there. I mean, you got to find out if it looks bad, particularly if it's a diabetic or somebody who really doesn't do well with infections. You better find out if it's starting to spread, because that's the difference. Well, here's a prescription. Go over to the pharmacy and you'll get a prescription antibiotic. See you in 10 days versus get your proverbial posterior to the hospital right now. Or I'm calling 911. See? And that applies, not that everybody's going to work in a clinical setting, but because it can happen to anybody. You find that a lot. A lot of times older folks, which certainly I am not. Thank you. Opportunity to smile. That older folks basically don't say, they don't like to complain because they don't want to go to the hospital because they don't think they're going to get out. My mother-in-law. I mean, don't take me to the hospital because I may never see my home again. It happened to her the last time. That was October, a couple of months, a year ago behind this. And she passed away in February 4th this year. 98 and a half, it's okay. It's a good run. So here's lymphangitis, painful red lines, inflammation of the larger vessels. And they contain, again, just like any vessel, they have vessels that supply the vessels. They become congested, etc., etc. It's low pressure. Skeletal muscle, breathing, valves in it to prevent backflow, arteries pulsating, smooth muscles contracting, physical activity. Okay. Now, that's the distinction. When we're looking, it's one way for normal. I mean, the way I would interpret that last bullet is, to keep the lymph system flowing and so it doesn't accumulate, you need to have a certain degree of physical activity. we immobilize things when we want to keep stuff there, so to speak, or we want to stop something from, obviously, for it's sort of self-explanatory for a broken bone. But other times, if somebody came to me with an infection in their foot, the diabetic, I mean, they have some doozies. There's no other way to say it. Some real messes. What do? You put them in bed. You propped up their foot for elevation. I said you only can get up to go to the bathroom. No more outside till we get this under control. I don't want, here's the antibiotics. Let me know if there's any change. That, it's really, that's a 5-alarm fire looking to happen. Everybody be familiar with these things. I share this with you again because it's not all about testable stuff. It's about me communicating stuff to you that's important. Because I mean, other than being students, you're actually people, which a lot of times instructors forget that you have lives. I've been around long enough that you're not going home and just doting on everything that you've had to learn in class. You have, wherever you're going, you have other stuff going on. You should stop the thing. See, my first wife was, if you notice I'm not a fancy dresser, it won't hurt me. So my first wife was, so I go out, my lab coat would have some stuff on it, maybe a stain. The shirt might not be completely pressed. The tie may not match. Her usual comment, how can you go out like that? What will they think about me? That was her context. So, which is why that marriage failed, despite the nearly 30. We were married for 30 years? Counting. Officially for 33 years. So anything that prevents normal return, things that block it. Cancer surgery. Lymphedema may improve, again, because some of the pathways, and that's why we use compression devices, just like we talked about with circulation. What's the area that has the most problems after breast cancer? What part of your body tends to swell up? With breast cancer, what else do they do a dissection of to make sure it hasn't spread? Nobody, huh? The axilla. Tail of the breast points, and we do this again with repro. Tail of the breast points this way. There's breast cancer. I mean, barring it being completely in situ, the tiniest thing's completely walled off. You have to do a biopsy of the lymph nodes here. If it's spread there, and the worse it is, the more you have to remove all those lymph nodes. The great actress Kathy Bates, she lost a lot of weight, but she used to be very heavy. She's at the end of her career now. Wonderful. I mean, she used to have to go in 6 days a week and because she had breast cancer and she had her breast removed. Put her on a sleeve, and you always see her in long sleeves when she would do her acting. Because they'd put a compression sleeve, she'd get the fluid pumped out, put the sleeve on, and get it done every morning before she went, whatever the studio was or the site. Very, very big problem that's there. So the cells themselves are lymphocytes. This is a little introduction. Okay. So that's going to my wife and I. That's fine. So immune system cells are everywhere. Most of them that you're going to find when we get to the lymphatics and we get to the immune system physiology, because this chapter comes immediately before it in this textbook, are T cells and B cells. T cells are for cellular damage, like cancer, cells that have been invaded. B cells are more about like free-floating stuff, viruses, bacteria that are in your bloodstream. They make antibodies. The B is for antibodies, and T means they come from the thymus. B is actually for bone marrow. So bacteria, toxins, viruses, mismatched red blood cells, cancer cells. T cells, it's about cells that are infected. B cells they morph into something. We go over this in immune. This is not anatomy. I just want to give it to you for the sake of completeness. These are called plasma cells. They're little factories that make antibiotics. I do a really good immune unit. And this year we'll do it more because Dr. Maurer, who's next door over there, is not. Oh, that's Dr. Dress over there this time. I think it's Dr. Maurer is here. Is doing. Is not doing immunology, right? Semester. It's not offered. It was last semester. So antibodies mark antigens for destruction. And you're going to see well, a lot of the white blood cells will go into, not doing this now. What you're going to see that the immune cells are all about these. What's interesting when we look at the thymus, when we look at the lymph nodes, this is where you see reticular cells. Remember, if you remember that we had collagen and elastin and something called reticulin. Reticulin is very, very thin collagen that's coated. It's so thin that we only find it where it acts as a strainer. We see it, for instance, in bone marrow, where the blood formation is going on. We see it in lymph nodes. Remember I told you about percolating, was sort of like a sifter, like putting the flour on top and where a lot of people will sift flour with just a regular strainer, do the tap. And like me, it's usually pre-sifted. I don't worry about that. So there's a lump. So it's like this. It's like nooks and crannies. It's a network. And in that network, you have all these reticular fibers, little nooks and crannies, and interspersed are all sorts of white blood cells, different lymphocytes, T cells and B cells, macrophages, because eventually they're going to gobble up the garbage when the other cells are done. It provides proliferation sites for lymphocytes, surveillance points. It's mostly made of, this is the other kind of soft tissue. We looked at luceralar, we looked at adipose. The third one, if you go back and look at that chapter, was reticular. This is where you find it. Inside lymphatic organs like the thymus, like spleen. So they live on those fibers, and the spaces are where they're sort of on patrol. It's a good way to describe it. So we almost find all this stuff everywhere. There's different types of things. Typically in the layer underneath the mucous membrane, we're going to see a lot of them. You'll see a lot in the gut. You'll see it under the skin. Again, areas where we're in contact with the outside world. And understand, your alimentary canal is outside, not inside your body. It's a tube that's got lining that protects it really well. And you're going to see things. We're going to talk about MALT, capital M-A-L-T. It's an acronym for mucosa-associated lymphoid tissue. SALT, skin-associated lymphoid tissue. GALT, gut-associated lymphoid tissue. So the nodules themselves, spherical, tightly packed, and this is where the things proliferate. And they may form a part of larger things, being nodes, and then even aggregations. This is what's in the gut. Peyer's patches, or where you see these. And the appendix is certainly just another one in and of itself. The appendix has a couple of interesting roles. Most people, myself included, when you have a really bad stomach, when you have colitis, when you have food poisoning, and you're pooping your brains out, okay, something has to, I was going to say another word. This is my best consistent audience. Effectively, that replenishes your gut bag. You have more bacteria in your gut than anywhere else. You have 10 times as many bacteria as you do cells lining your colon. And it replenishes, it's like a storehouse. So when it bursts, you can imagine how many bacteria are going to be there. And so the primary lymph organs, where they mature, all white blood cells are born in the bone marrow. The B cells mature in the bone marrow. The T cells mature in the thymus. And then once they're there, the secondary lymph organs are where the mature ones go. So whether they're lymph nodes, the spleen, what I talk about, all these mucosa-associated lymphoid tissue, or any diffuse tissues, that's where you find them. And it gives you an idea. So here's where you find them. I mean, the bone marrow, where they're born. The thymus, which is functional through life, but it's very large. When we dissect a fetal pig, which we'll do when we come back from break, you'll see the thymus. And you get an adult, whatever you're dissecting, that thymus is vestigial. It's almost shrunk completely. Still functional. It just gets smaller, and really it has shrunk substantially for you and I by age 17. And tonsils and adenoids and all that stuff is all over. And you can see Peyer's patches. And here's the spleen, which is bigger than you think. Spleens are big trouble. Okay. Spleens are an organ that, and when organs are filled, like a bladder, when they're struck, they can burst. Appendix, not so much. The appendix bursts because stuff's gotten trapped in there, it's gotten inflamed. It's kind of protected anatomically. But one of the worst things you can get is blunt trauma to the abdomen. This low, you're thinking about the bladder. This bag that's filled can explode. Spleen's like that, except it's filled with blood and other stuff. It's a classic example of why we're no longer as stupid in sport as we used to be. There used to be, somebody gets tackled and they got a helmet in the gut. Lying down, it's like, he just got the wind knocked out of him. And then with a couple of plays and they put him back in. No. If you follow like I do, there's a guy who you see ubiquitously on NBC and NBC Sports whose dad was a fabulous quarterback. When the Super Bowl with the Giants had like 18 out of 20 passes. Phil Simms was the name. Chris Simms. He's the guy you see all the time. Tall, slender guy. He was with Tampa. He got hit like that. The Tampa era, right after they had won the Super Bowl. In like 2001. I think he was around 2003 to 2005. He ruptured his spleen, ended his career. Blunt trauma. I learned that early on. Working emergency room. One of the things you got to watch for, you got to be very careful sending people home if you suspect it, because unless you have a high index of suspicion, all of a sudden they're bleeding internally. That's non-essential tissue. The lymph nodes are what I drew on the board before. Hundreds through the body, deeply embedded, nearer to the surface in the inguinal area. Again, contact points with the outside. Axilla, because everything goes there. Cervical region. It's a lot anatomical. Again, that same illustration I showed you before, color code. So what they do is they filter. The macrophages gobble up stuff, microorganism and debris, unwanted substances, because basically they're constantly filtering it so it's ready to go into the blood. And it's a place where the immune system discovers invaders. I mean, again, your mom's sitting there doing like this. You're swollen. I don't like that. You got a fever. Your throat looks awful. No, maybe that's a strep throat. We better get to the doctor and see if we need help. So, as opposed to just having a sore throat, and you just take the kid. Why don't you give me an antibiotic? Because you're not supposed to. It's a virus. Think of what's going on. So, immune system offer a place for lymphocytes to become activated and begin the defense. Maybe the defense they start. Antibodies take time to make. That whole process takes maybe 3 to 6 days to ramp up and 10 days to be full blown. That's why you take antibiotics for, that's right, 7 to 10 days. See? You learn something new every day. Do you ever wonder why they give it to you that? Why don't you just take it for a day? Well, what about that Z-Pack? That's a timed release capsule. It's designed to release it slowly over time, and those 5 days of dosages will continue to grow and be maximum of 10 days. That's why it works the way it works. It's not magic. So it's not stronger either. It's just a different way that's absorbed. So if you had me for micro, you would know that. You probably learned about the lac operon. Yeah? No? I saw lac operon today. You don't get the micros usually where you teach that. Okay, it's all right. You don't have to teach it. Just saying. This is what I used to have to teach it at one of those schools there. So they vary in shape and size. They have a capsule outside, and what they call trabeculi. Again, that's that sort of honeycomb appearance that we talk about all the time. The outside is called the cortex. The inside is the medulla for everything. Doesn't matter. And taking a look at it is better. So I don't want to go through all that stuff and where the cells are. Not a big deal. It's more physiology. The same thing here. I really don't get excited about any of that stuff. What I want you to, and again, I'll bet you, I'm spending a whole period on this. If we have 5 questions about this on this next test, it's a lot. So if you're going to skip studying anything, got it? And I won't turn around and put 25 questions on it, despite the temptation. Oh God, I'm getting an evil out there. See, multiple point. Look at the valves. Multiple points of ingress, filter through here, limited points of egress. That's it. I mean, in a nutshell. Same thing here. Little openings that you can see can be magnified. That in tonsils and adenoids, they're exposed to the air and to the food. They're exposed to materials you're directly bringing into your mouth and throat. You have lingual tonsils. You have your throat is your pharynx. You have pharyngeal tonsils. The adenoids are the posterior tonsils, sort of in the upper, sort of in the behind the, sort of in the nasal pharynx, behind your nasal cavity. And so they enter by afferent or incoming, and then they leave by efferent at that notch. And then whenever we see a notch like that, it's called the hilum or hilar area. And so you have incoming afferent and the outgoing efferent vessels. So because the fewer, it's somewhat stagnant, it allows the lymphs and the macrophage time. It's not a rapid process. And so it goes through multiple nodes. It's fine. It's like you're filtering and filtering and filtering. In the baking industry, we call that triple sifting. So it makes that very, very fine aerated flour. Back to the Oakmont Bakery for me. One day, if my wife and I are there, I'll give you a buzz if you're home with me. You have a lady lock on me. And anybody else is in proximity, I'll be glad to entertain you. And so, I love this. Inflamed lymph nodes that became necrotic, blackened, and dead were called buboes. And because that's what plague was characterized by, that's where we got the name bubonic plague. It's a bacterial infection that is carried to you by flea bites. I mean, the rats, that's why the rat control is the issue. The rats carry it in their bloodstream. Okay? The fleas bite the rats. When the rats die, they have to find another host, us. And we get bitten. So if you control the rats, you don't have the fleas that are infected, and you got the idea. That's the way it works. And so, and yeah, there's swollen glands in some, but bubonic plague was named after this feature because they got enlarged, they were nasty, they were blackened. And so, into this day, what I don't know, but maybe your mom called it that. What did they call it? You had to hurt yourself. They called it a boo boo. And I always thought it was a little bear. It was Yogi. Oh, Yogi, don't do that. The ranger's not going to like that. Oh, I want a picnic basket. None of you watched cartoons as children? Sadie did. No. I know, too sophisticated. My children hated me. I've got a great grandchild to do this to. I mean, I've made my we're watching cartoons this Saturday morning. My children, my granddaughter. Do we have to watch cartoons again? Yes. Because I like them. Well, you're just no fun as grandparents. Which is good. You have to get into that stuff. All those kids, Dora, backpack, bridge, waterfall. Love that. So lymph nodes, secondary cancer sites, that's because the whole thing about being infected that are there. The spleen, two more things to cover. The spleen is double duty. It cleanses your bloodstream of bad red blood cells. The reason it's non-essential, the liver can do it. I treated a lot of people post-Vietnam vets who had spleens that were removed because of gunshot, shrapnel, and blast injuries, etc. Their spleen came out, their liver could take over. You just had to remove it. So that's one of those arteries we learned about, splenic artery. Okay. And this is, again, they proliferate, they're under surveillance. It's got two things in it. One is called white pulp, and one is called, it's got a very elaborate blood supply. It's a bigger organ than you think. Here it is. Okay. And what happens, it basically breaks down red blood cells, can store iron, stores platelets and white blood cells for release. So there's a lot of these areas where we have like pools of white blood cells in case of infection that are released. And yet, even fetal red blood cells, one of the areas where, and again, when it says maybe, we're not sure. White pulp, which is the immunological one we're talking about, and red pulp, which is the blood one. So where the immune system and the lymphatics go is white pulp. Immune function, lymphocytes and reticular fibers, clustered around arteries, appears islands of white. You see, red is everything else. And again, it's not relevant. They illustrate it here where it's mostly red. But it doesn't make it any less important. You don't get a lot out of those illustrations. And surgical removal ruptured, one standard treatment. We don't do it as much now. As long as you can get the bleeding under control, it's different. And this textbook's maybe, this information 8 years old. But back then, 20, 25 years ago, you took out spleens. Like I said, that football injury is not the only one. When Ryan Clark, when he was with the Steelers, ruptured his spleen from, because he's sickle cell trait positive, up in Denver, because the air was thinner, he ruptured his spleen and his gallbladder, not related to trauma, but they had to take it out. They couldn't play again up there. And the splenectomy, spleen will regenerate if a small part is left. Here's the mucosa-associated lymph examples: tonsils, Peyer's patches, and appendix. You don't have to know all of these, certainly, but at the end of the oral cavity, these are the ones that would typically, when someone has them removed, it's the palatine tonsils, not so much the lingual under the tongue, the pharyngeal tonsil behind the nasal cavity, that's adenoid. So we use the term tonsils and adenoids. Like you'll put that, excision tonsils and adenoids, for identifying the surgery for the OR. And even ones in the auditory tubes, but I don't think they work on those. And so, and again, it's the exposure to the air. They're not encapsulated. They have these little clefts they call tonsillar crypts, and the matter just comes in there. I mean, you don't want to lure it in there, but this is part of why we're stupid if we don't go out. Don't get me started on the COVID thing, please. Young, healthy individuals like you lost what, a couple of years of school properly. Right. You can see Peyer's patches. Nothing really special here. The appendix I told you about destroys bacteria presenting from breaching intestinal. Well, not really. Again, most of the time it's just holding on to the bacteria. The thymus is more about T cell maturity. Stops in adolescence, then gradually atrophies, which means shrinks. Still active and producing, size just changes. And again, it's less about blood flowing to it than producing the T cells. Okay, doesn't have B cells in it anyway. Is not directly involved in that. And there's a barrier, so effectively stuff through it doesn't over respond. When we get to the immune system, you're going to see we don't want to release T cells because they're nasty until they're ready. There's not a whole lot to say about that, and we're done. We will do respiratory Friday. I was going to tell you to breathe easy. Nobody thinks you're